O kia ora whānau. We're nearly there, the finish line, or is it the start line? Thank you that you've stayed to the end here. Often the room empties out as people have to leave, but I take it as a good sign that you're here and you want to be here for this final session. Over the long weekend just gone, I took the opportunity to sort out a few boxes in my study at home. For those of you who have seen my office at the ministry, you transfer that to home, you'll get an idea of what my office looks like. But some of these boxes contained things from my parents' home that we cleared out 2 years ago when my father died, and I discovered in the boxes many mementos from several generations of my family, and amongst them were many gems and some things that really made me think, and particularly about my parents and the impact they'd had on me. One box that I pulled down off the top of my shelves contained a range of papers and reports from the 1990s that I had accumulated when I was a public health medicine registrar specialising in public health. And it also contained some gems. One was particularly striking, and I've brought it along to show you. It's called Healthy New Zealanders, Briefing Papers for the Minister of Health 1996, Volume 1, Key Policy Issues. Now, at the time that briefing for the incoming minister, or BIM, as we now call them, was written, Dr. Karen Patasi was the Director General of Health. She's been here for the forum these last 2 days. She's now the Commissioner in at Waikato District Health Board, and I have to say, I remain in great admiration of Karen, in particular the energy she brings, that she had then when she was DG, and she still brings to the role she's at. And I showed this to her this morning, and she recognised it immediately. I thought I'd just read through some of the headings on the contents page. We could do better on health outcomes. We could do better on health and disability support services, tackling some long-standing problems. And here, I'll come back to that, because the first one of these long-standing problems is called, somewhat cryptically, aiming for more than middling. I'll come back to that. On we go, balancing the inevitable tensions. Would it help if the structures were changed? Realising the potential of the sector, and the first subheading is leadership, focus and clarity. And here we go. I should say that earlier on under We Could Do Better for Health and Disability Support Services, the first subheading was Doing Better on Māori Health. Here's another heading. Is there enough money in the health and disability sector? And finally, under Next Steps, an agenda for a healthier New Zealand is Inter-Sectoral collaboration for health. Coming back to that somewhat cryptic heading, aiming for more than middling, if you open up the report, it says, in general terms, the motives for reform include, these were reflecting on the reforms in the early 90s, included more effective and efficient use of resources to achieve the following: health gains for the people of New Zealand, greater coordination of care, services more responsive to consumers, including Māori, clearer and stronger lines of accountability, cost containment and increased focus on public health, and the removal of conflicts of interest in the area health board structures. That was the rationale for moving to a purchaser-provider split at the time. I found that quite salutary. Does it sound familiar? Plus ça change, plus ça même chose. The more things change, the more they stay the same. I think there are three things we might take from this. First, the fact that the challenges and issues that we are dealing with, we are grappling with, and we are here to discuss now are not new, does not mean we have failed or got it wrong, or indeed that we should be cynical or despondent. Rather, to me, it emphasises that the fundamental challenges in our health and disability system are long-standing and, most of all, they are complex. This should come as no surprise to any of us, and I doubt it does. After all, the late management guru Peter Drucker describes just one part of our system, the hospital, as the most complex human organisation ever devised. Second, because they are complex challenges, they cannot be resolved by simple unidimensional solutions, or by one particular idea or one actor. The answer is not simply more money, or more coordination, or more leadership, or more of this particular professional group, or specialty, or technology. It requires all of these and more. These complex issues require sophisticated thinking, multidimensional responses, and above all, a wide range of actors working towards a common outcome or vision. And as has been highlighted over the last 2 days, we have to collaborate. We need to work together to continue to make progress on these complex issues. And the third point I think it's important to reflect on is that we need to pause periodically and reflect on progress achieved. Have we improved safety, quality of care, health outcomes, efficiency, Māori health, accessibility to services since 1996? Most definitely we have. Have we achieved everything we aspired to back then? Heck, no. By way of example, there was another document I found in my treasure trove from the mid-90s. It was the New Zealand Public Health Report from July 1998. A very topical heading of the lead article, Immunisation Coverage and Risk Factors for Immunisation Failure in Auckland and Northland. Believe me, I've given this a lot of thought over the last few months, as have many of you. But just as you look in that article, there is a table that includes the vaccination coverage of our mokopuna, of our tamariki, back in 1996, fully immunised at 2 years of age. Get this, Māori, 44.6%, Pacific, 53.1%, other ethnicities, 72.3%. Have we made progress? Amazing progress. Are we there yet? No. Is the challenge ongoing? Yes. But we do need to pause periodically and reflect on our successes. The solutions to these challenges and complex problems that we deal daily lie with us. As I've often been heard to say to my team, no one is coming. No one is coming. It's up to us. However, fortunately, that was not the case with this forum. You did all come. Thank you for that. In the first session, I explained why we convened this forum, and I just want to reflect back on that because some have been asking that question. Here's what I said. A key role for the ministry and the wider health and disability system is to convene, to bring together the full range of stakeholders that are essential to ensuring New Zealanders receive the services they need for their health and well-being. This forum provides the opportunity for us all to hear about, to discuss, and to better understand the future direction of the system, as well as helping us all refresh and generate the energy needed to renew our focus and commitment to improving health and well-being in Aotearoa New Zealand, and in particular to achieve equity for Māori and indeed all New Zealanders, which I strongly believe is a common aspiration. So that's what I said at the beginning of yesterday. I sincerely hope that in attending the forum you have achieved some or all of these objectives yourself. I have been inspired, I have been re-energised, I have written a lot of notes and have a lot of great ideas to take from what I've heard. Thank you all for coming. Thank you for contributing, for bringing your energy and ideas, and for your ongoing commitment to health and well-being in Aotearoa New Zealand. Thank you, Nadine, for being an outstanding MC for us. A huge thank you to all our speakers and presenters. You've been fantastic. You've gone out of your way, and for those of you who had to do it 4 times over, a special thanks to you. I do want to call out the team in the ministry who've done a fabulous job of organising this with a very short runway, and 4 or 5 people in particular, and I'm going to name them because they have been outstanding. Lisa, Megan, Alex, Mikey, and Sarah, who heads up my office, the Director General. Can you just put your hands together for those people? And finally, the challenge, the wero, which in a sense was laid out for us in the interim report of the Health and Disability System Review. And Kere Ana asked this question of Heather directly about the lack of leadership in the sector. Now, you all have your own ideas about what that means and indeed what we might do about it. But that is a challenge for all of us. My strong sense is that we're up for it. For our part in the Ministry of Health, we're certainly up for it. We'll be doing our bit. And what I can say is that we have already started to develop up a proposal around a sector-wide leadership development and support program. I think this is something that we used to have a little bit of in the sector, and we need to be really deliberate about supporting, training and developing our leaders right across the sector, clinical and non-clinical. And we're going to be developing up a program to do that. We look forward to involving you in both helping shape that up and, of course, in delivering it. So I look forward to continuing the work with you beyond the forum. When is the next one? Well, I'm told by Lisa, organiser extraordinaire that she is, that she's already booked the venue for April 2021. So we'll let you know more about that as it firms up. Tēnā koutou, tēnā koutou, kia ora tātou katoa. I'm going to hand over to John now for the mihi whakamutunga. John.